And we've been receiving, we've worked with the students who have been coming during the summer. They've been bringing medical supplies and stuff. And then we have some faith-based organizations like the Church of Pentecost, the Ghanaians in Japan. They donated some items to us. And then also United to Heal also have also given us some medical supplies. So far this is what we've been able to achieve. When you look at it, we move our outpatient, those people who come to the OPD, we move it from 48,000 to 64,000 within 3 years. Within 3 years, we've improved access to, OPD. Formerly, most people, when they are sick, will not have anywhere to go. But with the opening up, and that's the graph, that you can see that from 2006 to 2009, more or less, we have doubled the number of patients who are coming to the outpatient department, which is remarkable. And one of the things that we are also doing is that in 2006, a social insurance, because when the hospital was not there, those who were insured did not have access, although they have the card, the insurance card, but they did not have access to care. They have to go to the next district. But with that, now they could access. And you can see how those who have been insured is going up from 8,000 to now 51,000, who now, with the insurance card, can have access to care. And then this is the community health officer that we have put in the peripheries to see clients in the peripheries, in the villages and the communities. From 2006, the community health officers were seeing about 2,000. Now they are seeing about 9,000, which shows how we've improved access in the peripheries. And then in terms of surgeries, admissions, we've admitted, almost like 1,989 as of last year. And these are the surgeries that we've done. And we have although we've improvised, and we are very conscious of quality issues. The quality of the surgical intervention that we provide. And we usually monitor it looking at infection rates. And our infection rate for our surgeries are quite reasonable. Within under 5%, which is quite okay. And then these are the provision of safe motherhood, that is antenatal, prenatal care, the deliveries, with the midwives coming in, the deliveries are going up. The family planning is also, that's also one of our strong points. We have Ghana as a country, the coverage of modern contraceptive from the Demographic and Health Survey is 15%. By the Senate District, about 45%. We have strong community programs in place that give access to women for family planning practice. And then this is the immunization. We have very good immunization coverages. With HIV, we started offering antiretroviral therapy to our clients. And our estimate of the prevalence, we do prevention of mother-to-child transmission of HIV also. That is, women who are HIV, we make sure that they do not pass it on to their children because we screen pregnant women. And that is what we've done. Last year we screened 1,000 pregnant women and 20 were found to be positive, and they have been put on antiretroviral whilst we are monitoring them so that, their babies do not get it. And then we started antiretroviral treatment within the district. Formerly, they needed to go to Kumasi for antiretroviral treatment. Now, the people in the district have access to antiretroviral. And there's also one of our strong points. Guinea worm is one of the scourges, of poverty. People get this disease by drinking bad water, or water with the parasite in. The parasite goes into them, and then a year afterward, the parasite will appear on any part of your body as worms, and it's very debilitating. And in farming communities, it can break down the whole community. People cannot go to the farm because they've been weakened, their legs are swollen, and it was a big problem in Senate District. 2006, we have 41 cases. From 2008, we've broken the epidemic. So that for the past 3 years, we've not had any case of anywhere. And because it's a 1 year cycle. Because it's a 1 year cycle, once you are able to break it for 2 years, then you've broken it within because the incubation period is 1 year. So when you double the incubation period, then you broke in the cycle. So we think that now the district is freed of guinea worm, and that is a very great achievement for us. And we are one of the few districts we actually perform a vasectomy. The only vasectomy I think in the whole Bronga region. And then we're using PDAs at the peripheral level to collect data. That's also something that we are championing. And there's a lot of national interest on it. I mean, using PDAs to collect data. Yes. There are still challenges that still remains. A lot of challenges. I mean, frustrations, writing proposals. You write 100 proposals, you get small. I mean, acceptance. Sometimes you get frustrated. I mean, and inadequate support. I mean, they dump you in the district and forget about you. I mean, good riddance. Now we've got a doctor there. And sometimes it gets very disheartening. You need to get your balance. And then also the traditional system, the public sector, bureaucracy and inefficiency. It's terrible. I think it's but in Ghana, it's terrible. The red tapeism, the bureaucracy, the rules, getting things done, it's amazing. I mean, you try to get something maybe even from the, I mean, you have somebody sending you items in, and you try to clear it from the port, it takes you ages to get it out. Yes. So those have been very, and then suspicion, people, and it's unfortunate, in our system now, the spirit of public service appears to have been lost. People do not understand that somebody can work out of love and commitment. They always have a suspicion that, look here, what this guy getting from it? Why is he working so hard? He must be getting something. I mean, the spirit of public service appears to have been lost, and that is terrible because you work with people and people are always suspicious. What's happening? What's this guy getting? Why is he working so hard? Why is he doing what he's doing? He's not giving us a cut of what he's getting. And it's terrible. It really sours the working environment. Yes, I mean, that's something that is a challenge. So we're looking into continuing to improve things with more collaboration. And we look everywhere. We support, I mean, and now MTN Foundation. MTN is a corporation in Ghana, it's a telecommunication corporation. And one of my proposals to them have been accepted. They will be coming to put out more infrastructure for us, which is very, very good for us. And then also we are advocating for more things and also intensify and maintain vigilance on the guinea worm epidemic in the in the district. Because with the guinea worm, the northern regions still have cases, and they bother us. And the problem with guinea worm is that if you get one person with the worm coming into your district and contaminating one water source, the next year you have a full-blown epidemic. So we've set up community structures that is continuously monitoring and making sure that we keep an eye on it.